Welcome and thank you for joining us for the first Family Reach session series. My name is Jackie Hess, and I'm the Senior Manager of Programs Innovation here at Family Reach. I'm so glad you've taken the time to join today's discussion focused on asking for help during your cancer experience. My hope is that you'll leave today feeling more confident in seeking out resources and support that may help you lessen the financial impact of your cancer. Before we begin, I want to take a moment to thank our sponsors at Karyopharm Therapeutics for their generous support in making today's conversation available. With that, I'd like to turn things over to our moderator for the afternoon, the Executive Director of Legal and Compliance for Karyopharm, Mr. Jim Accumano.
Hi, Jackie. Thank you very much for the introduction. And thank you, Family Reach, for putting this together and giving me the opportunity to be a part of it. As Jackie noted, my name is Jim Accumano, currently the Executive Director of Legal and Compliance here at Karyopharm Therapeutics. I'm an attorney by training, but most important for this discussion today, I'm also a cancer survivor. I was diagnosed with testicular cancer about 16 years ago, back when I was still in law school. And today, I still remember all the CT scans, the PET scans, blood test, chemo, the uncertainty, the bills, and the experience of realizing that somehow the smell of rubbing alcohol and latex bandage wraps in particular had genuinely become emotionally triggering. But more than anything, when I reflect on all the experiences, I'm deeply grateful for the network of support that helped me and my family get through it all. And it's why I feel enormously privileged and humbled to be a part of this event and the moderator for this fantastic panel. So thank you, Family Reach, truly for the opportunity. But with that, I'd like to introduce our first panelist, Kelly Corona. Kelly Corona is a licensed physician assistant with a doctorate in health sciences and an MBA. Not bad. She has practiced in hematology and oncology for 20 years and is passionate about helping patients throughout their journey. Kelly has been with Karyopharm for over 6 years, supporting research and development, and is currently the Senior Director, Head of Global Medical Education. Kelly, thank you very much for joining us on this panel. Finally, I'd like to introduce Michael Longo. Michael, who joins us today to share the patient perspective, is a father of 3 active young children and husband to the love of his life, Leslie, who he describes as the leader of his warrior team. Michael is dedicated to his work in construction, once operating heavy equipment in major construction sites in Boston, and now a bit closer home north of the city. On top of all of that, Michael is a survivor of stage 4 lymphoma. He's endured intense, sometimes debilitating chemotherapies and surgeries, but he's overcome all of it with grit, determination, most of all, a smile. He's done so to stay strong for his family, to stay in the home he has worked so hard to renovate, and to raise happy children. We are honored to have him here with us today to share his perspective as a cancer survivor. Thank you, Michael, for joining us today. And before we get, welcome. And before we get to the conversation, we'd like to share a brief video with you all to help you get to know Michael a little better.
It kind of all started with a cough, and I started having fevers and like night sweats started coming on, progressively just worse. It wasn't even like week by week, it was day by day. I'd go into the doctors and they'd say, no, it's walking pneumonia. You're good. You can go home, just take some Centrium and here's a Z-Pack.
I said, no, my husband is dying. Something's wrong with him. You need to help me. Like, he can't function. He can't go to work. He's so sick. Finally, they told us, yes, we'll do a scan. And it came back positive with lots of lymphoma all over his body. And finally, there was an answer, and I was actually happy for that because he was getting treated for what was necessary.
For me, non-smoker, non-drinker, just wanted to raise my kids, have a family. We just bought the house, and it needed a lot of work. We're a growing family. It was devastating.
Our family changed drastically because we had to figure out how we would get to the next appointment, how I would find somebody to watch the kids, to be by my side, how can I visit him, and me just taking on that sole role of being everything to everybody. I'm taking care of the kids, I'm taking care of Mike, and at the same time wondering if he'll survive.
Now, on top of our original bills that we already couldn't afford, there were these medical bills that were just astronomical.
I told them at the beginning, listen, there are some things that we can access, and it's helpful to me to think kind of a timeline. If you can go home tonight and think about, okay, what's coming down the pike in 2 weeks? What's coming down the pike in 8 weeks? And let's try and time some of the access for these resources to have them have the most impact.
The most difficult part with Mike was he felt the pride. I don't want to accept the help, but when I told him that we had help, it lifted his spirits. Like he could jump over that fence, he could beat this cancer because financially things were easier.
You know how like when you come up from the water and you take that big breath of air and you're just like, oh, I got air again. You know, that was for me, that was what it was.
It's a very psychosocially demanding treatment. Families have to mobilize their internal resources, sometimes external resources. It's really challenging, but the experience, which we wouldn't wish on anyone, can crystallize the great strengths in families, and that seems to be what's happened with the Longos.
I just take it one day at a time. I suck in every minute with my kids, and the moments I get with my wife, be it as it may, they are hospital dates that we have. You know, we go to the hospital, and that's our date night.
You meet people and they don't realize that they think they're having a bad day, but it could be so much worse. And every day I look at that, and I think I'm a completely different person for the better.
For me and her, it's made us stronger. She was the glue that kept us together. I lost it a couple times, you know. When you sit in a room for 30 days and 30 nights, so many things go through your head when you're by yourself in a hospital room. If I knew what she was gonna go through over the past 4 years for us, it's been hard. It's been really hard. And I'll always love that kid's laugh.
So, Michael, that was a great video, and I know that was shot back in 2018. Maybe you can provide us all just a brief update on what your experience has been since that video was filmed.
So since then, I've relapsed, I think, a couple more times. But again, I've had treatment, I've had trials, and successful trials. I've had a couple reactions to the trials, but for me, it's just kind of one day at a time. I've always lived life like that, especially since my first diagnosis. And like I said, I had a pretty severe reaction to the last treatment that I got, but pulled through. And I'm just fighting every day and enjoying life and loving my kids and my wife, and still working on this house because it's nonstop.
I believe it. No, thank you for sharing some of that. And I know it's been a long journey since 2018, and so much has happened for you. But for the benefit of everyone who's tuning in today, maybe go back to when you first learned of the diagnosis. How did you feel? How did you react? What was that experience like for you?
Yeah. So when I first got diagnosed, I panic sets in, but at the same time, you gotta, like, it's almost surreal, like you don't believe it. And, but it, over time, it makes sense that you gotta start making decisions and deciding what you're gonna do, how you're gonna pay for stuff, how you're gonna do stuff like that. So and basically I was just lost for words.
Well, no, I'll share with you briefly. I mean, I will never forget the moment that I personally got the news from my doctor, and whatever you think you know about how you'll react to something, it all just falls away, and it's just shock. And I recall that experience. And I wonder, I guess, from your perspective, what helped you transition from that moment of, oh my goodness, this is real, to how am I thinking about practically? How am I going to handle this? How am I making appointments? How am I going to start thinking about finances? How did that transition happen for you?
Yeah, so the transition was slow. At first, I was just paying bills using credit cards and stuff like that financially. And I was trying to just keep up with everything as it came. slowly fell behind. And then, you know, I started getting better from treatment, and it was a short remission, but it was a remission nonetheless. And I was still going to work every day. And I was, you know, the company I worked for helped me out a lot. People that I didn't, you know, think were going to come out of the woodwork came out of the woodwork, and they helped me out. They gave me, you know, advice that I, you know, looked deeper into. My wife looked into like online forums for people that have gotten sick, and she found, you know, that help with that. Like, you know, people like look, research for foundations, research for places that, you know, will help you financially, places that'll help you mentally. And you know, I just took it one day at a time in that sense.
Well, you know, Michael, something that you had shared when we had previously talked was when you'd first gotten sick, you were pushing through it. Like you said, you'd kept working. You were thinking, I can make it through these financial hurdles. I'm just going to keep working, keep pushing through, and it's going to all wash out in the end.
Right.
And you'd also shared that, you know, your first relapse, for example, that made it a lot more difficult to continue telling yourself that I can just keep working through this. The reason I bring that up is I think it might be helpful for everyone else to hear a little bit about, you know, that transition for you of, I think I can, and then, you know what, I think I need some help.
Right. So, yeah, so I got diagnosed, I got sick, I was paying bills with a credit card. And then thinking I was just going to get out of it, you know, think I was going to go back to work. I was going to work some extra overtime hours and pay off the, you know, the bills that I had accumulated over the treatment months. Because, you know, they say it's 6 months worth of treatment. So in my head, I'm thinking, all right, 6 months, I'll be good to go. I'll be ready to go back to work. But that's not the case. It's, you know, it's still affecting me today, you know, 6-7 years later, it's still affecting me. That first treatment, I know it is. And so as far as that goes, when I relapsed, it was like, oh man, I can't do that again. I can't do what I did the first time. I can, because I'm not going to be working, because I just went through it. I know I didn't work, and I know that I didn't, you know, pay the bills the right way, you know.
Yeah.
You know. So that's when we really looked for help, and we really started asking people. And Jen from Mass General, who was on that video, she had mentioned some foundations and stuff like that. And that's when we like really started looking for, you know, help and how we're going to do stuff. You know, what's the next step? And also, like I said, my wife, she looked into, you know, other things, and she found actually foundations that weren't brought up to our attention. And she shared them with Jen. Jen has in turn shared them with other patients, I'm sure. So for us, it helped us, and hopefully it helped other people. But it was people at the hospital that helped us. Friends that you wouldn't expect helped us. My company helped us, you know, a lot. And Family Reach is one of the places that helped us immensely.
That's outstanding. And it's great to hear that. I wanted to ask you too, you know, you've mentioned the community, your friends, your wife, and this interconnected network of support. I think it would also be helpful for everyone to hear, how did you feel when you were reaching out to your loved ones or your community for help, and what was that experience like?
Yeah, it was tough. You know, like my wife says in the video, I'm a do-it-yourself kind of guy. Yeah. And I was just gonna, you know, I didn't reach out to I have siblings. I didn't reach out to them, which, you know, that's what siblings are for. That's what I'm raising my kids to be like. You know, if there's ever an issue, you know, you should be able to turn to your brother or sister and say, hey, I need a hand. And for me, I'm not like that. I don't know why, but I just was like, no, we're gonna do this. We're gonna figure this out. And you know, it's tough living like that, and you shouldn't. And you're hearing it firsthand from me that went through it. You shouldn't live like that. You know, if you need help, you need to reach out and ask for help. And you just got to know the right people to ask help for. But you know, nothing a little research can't help in that sense.
So that's actually a perfect transition to maybe asking a bit about, you know, what kind of specific support made a difference for you and your family's financial stresses?
So specific support, as in like the foundations that we asked, or the foundations that we did research on?
Yeah, no, I think sharing with everyone, because you've gone through this journey and you and
Right.
your wife, like you said, have reached out to so many organizations. And
Right.
I think it's helpful for other people to hear about that experience and also some of the things that you had done that did help your circumstance.
Yeah, so there are definitely foundations out there that are a little easier than others. And you know, you gotta put your feelers out there and you know, submit as much paperwork as you can to receive the help, because that's what they want. They want, you know, some places want more proof than others that you're sick.
Right.
You can't just send a picture of you with no hair, no eyebrows and be like, yeah, I have cancer.
Yeah.
So you know, that's it, and it's painstaking. You know, and I wish I had, you know, this me 7 years ago sitting next to me saying, hey, you know, this place is going to help you. This place is kind of a pain in the butt. This place is going to help you. But I'm here now and I'm willing to help people that are going through it, you know, and I talk to people randomly because, like, one time I was at a baseball game and a friend that was playing with my son, his father came up to me and he said, somebody told me that you were fighting cancer a while ago. And I said, yeah. And I gave him a quick spiel, and he'd asked me a quick question, is there any places that could help, my uncle? And I was like, yeah, this place, so like I said, you just gotta walk up to random people and ask them, not random, but like people that, if you know, and my wife is on a group online. She still talks to these people that, she started talking to 7 years ago, and they were, they're asking her, some people have the same diagnosis as me or similar, or they're going through the same problems that I'm going through. And she saw it firsthand, and so she would say it, and then she would ask me, what did it feel like when you lost, feeling in your fingers, or what did it feel like when this happened, so, and I tell her and she would respond, it comes back, little by little, and you don't really realize it because it's coming back so slow. But, stuff like that is always helpful.
I mean, that message resonates a lot with me. I recall, I don't know if you've shared this experience, but at a certain point, it became easier to talk about all the poking and prodding that you would receive from the doctors than it did to talk about the bills and the confusing financing and insurance.
Oh, yeah.
And somehow I was more comfortable with that experience of being a patient than I was being someone who needed to find help for the bills.
Right.
And I think it's great that you're sharing the experience of how you had come to that point and you realized it was important to ask for help. Something else that we had talked about beyond just the community and family, but you'd mentioned that your medical team had also initiated some conversations about money. Tell us maybe a bit about that, talking about finances, social worker, and how all that came to pass.
Yeah, so some social workers, actually all the social workers that I had, because I was at a few different hospitals, they brought up, looking into foundations that could help, looking into what bills you could pay, later, what bills you can pay sooner. If there's any way you could, if you had like a, hate to say it, but like a 401k or something like that you could tap into that could get you through these couple months that you're going to be out of work. Stuff like that is huge. For me, it wasn't really available like that. So we did as best we could. And there's also so the state offers a lot of resources. We have oil at our house, and the state offers stuff like, you can get oil delivered, if you're out of work or you need, you just need a little bit, there's places like that are out there. And like you said, and my medical team, the social workers, they're the ones that would, mention that. But at the same time, you got to kind of do the legwork, because they're handling, dozens of patients, if not hundreds of patients that are going through similar situations. So they mention it, and you just got to take the initiative to follow through with it. And if you do that, then it'll take some of the burden off. And then there's, like I said, there's foundations, like Family Reach is definitely one of them.
Yeah.
Where they take a huge burden off. You know, for us, it was, you know, they helped with a mortgage payment. I think they helped with a few mortgage payments. And that was, like I say in the video, when you come up out of water and you can breathe again, it's a big deal, because even if it's just for that short amount of time, a month, that you don't have to really worry too bad about something coming around. You know, that's big.
Did you have any experience with any financial counseling or any advice that you'd received from, for example, social workers in terms of how to manage some of those finances?
You know, I've been pretty good as far as handling the bills myself. So as far as financial servicing, we did connect with a couple companies, like financial advisors that would they would, you know, tell me, you know, what ways to save money, what ways to, you know, to cut the costs. You know, you don't need Dunkin' Donuts every day. You know what I mean? So stuff like that. And you know, in my head, I you kind of know that. You know that, like, you see what you're spending and you write it all down. That's another big thing, is, you know, having the social worker sit there with you while you're writing down what your bills are, your budget is, and putting them side by side and seeing what you can cut out and what it's going to save you. So that we did that. I still do that. I learned that when you know, that was one thing that I didn't know I should do 7 years ago. I still do it probably every 6 months. I sit down and I write down my budget. I write down my bills, and I see if we're doing better, if we're doing worse, if we're you know, we're just right. And most of the time we're just right. So it's definitely helpful. And if you have questions, they deal with me, right? So I'm one person, and this is the social worker. I'm one person, and I give them input, because they ask you questions in, you know, rebuttal, like, hey, how'd that work out for you? Because you see them every once in a while, and you say to them, that worked out good, you know, or you say, not so much, you know, maybe, you know, I wouldn't tell the other person that, you know, I wouldn't tell the next person that, but they see it all the time. So they know what helps, they know what doesn't, they know what foundations, and they'll tell you, they'll say, this foundation's kind of hard to, you know, get them to help you out, or, and, you know, but this foundation's really easy, or, you know, you just got to submit this paperwork, and they'll do the running around sometimes too, like go and get your doctor to write a letter to say, like, yeah, he is sick and he does, you know, he needs some medical attention, he's going to be out of work, or whatnot. And so yeah, social workers and financial advisors are definitely helpful people in the ordeal that you go through when you get diagnosed.
You'd mentioned that your care team actually helped broach the subject of financial support with you. And you'd also shared that, you know, while they had done that, it's up to you, the individual, to follow through on some of that advice. Do you have any advice that you would offer to folks watching about, you know, how to make sure that you follow through and take advantage of that opportunity?
Yeah, absolutely. So when it's fresh on your mind, like when you right after you leave the social worker's office, or even in the social worker's office, she's going to write it down. You save it, you put it in your pocket, you go home and you do it. You know, God forbid you don't have 2 1-year-olds and a 3-year-old running around at home like I did. And, you know, you have time to actually do that. But, you know, having that, you got to have motivation. And I know how hard it is to have that motivation when you're sick. And when you get, you know, when you get that news that you need to go get treatment, and that's really all you're thinking about, because what if, you know, what if I'm not going to make it? You know, why am I doing all this if it's just not worth it? For me, I had a huge, you know, my family, I live for my family. I live for my kids. I live for my wife, and I make it that was one of the biggest reasons I was just fighting through this whole thing, was because I think about them more often than not.
You follow through for the people you love and the people you care about.
Yeah, it's
that's an
huge
important
motivation. Yeah,
that's perfect. I think that's that might be a good time to bring Kelly into the conversation. We talked a little bit about Michael's experience engaging with his care team, and how they had helped open the door to some degree of support. But, you know, Kelly, as a provider in the past yourself, how would you suggest that patients bring up this topic, financial distress potentially, with their care team?
Yeah, Jim, I think Michael has really nailed it, but I think it's really patients, being vulnerable and asking for help. I think as a healthcare provider and the teams that are available for our patients, we want to help. I think it's probably overwhelming when, you're first diagnosed, from even pre-diagnosis throughout the entire treatment paradigm and thereafter, to ask for help. I think inherently, most of us as human beings don't like to ask for help. And I think that's probably the biggest part and hardest part, is to just be vulnerable to ask for help, because there's a multitude of resources available for patients and their families and caregivers. And as a healthcare provider, we want to help not only patients like Michael, but his family and the caregivers that are around to support him financially. Sorry.
Life gets in the way. It always does.
Not only financially, but, from a social work perspective, if there's nutritional needs, there's opportunities to provide meals to families that are in need. There's so many different caregivers and teams that are available for the different parts of the entire cancer journey, that I think, there's just a multitude of different services available, from what we've already discussed financially and from a social work perspective. But then when you think about even emotionally or spiritually, resources available, physical therapy, occupational therapy, speech therapy for those that may have surgery on the vocal cord area. If there's, swollen lymph nodes, lymphedema, support, there's just so many things available for patients and families that, we need everyone to ask. Whatever it is the ask is from that respective patient and the family, there's healthcare providers want to help. And I think lastly too, there's so many different patient advocacy groups available. There's, folks like Family Reach on the line. There's also, nowadays social media groups, Facebook, LinkedIn, Twitter. There's all groups available, for families, for patients to all connect and share experiences and ask each other, questions and help. That it's just so easy to get help as long as people are asking each other. And I loved how, Michael, you shared, one of your son's friends' parents, I think that's who you mentioned, excuse me if I am speaking incorrectly, but just people inherently, I think want to help each other. And I think often it's hard to accept a lending hand, but, we're all here to, try to enjoy life as best as possible and help each other as best as we can.
Thank you, Kelly. That was great. And I think something I'd like to go back to, Michael had shared the importance of following through and the different reasons why people do it. And what that really meant for me, what I was taking away from that, was just how hard it is sometimes to act, and how sometimes you need to focus on things outside of yourself, push yourself to do things you're uncomfortable with. And so I'm wondering, in your experience as a provider, you've touched a little bit on this already, but how have you seen patients, or how would you recommend that patients kind of reach out, and to whom? And maybe a bit more detail about your personal experience there.
Yeah, so I think, it's, it's probably patient specific, but I think to start, to be vulnerable and to ask whoever from your healthcare provider team is your go-to, right? Your nurse, your social worker, your physician, if you're getting infusion therapy, if there's an infusion center, whoever you're most comfortable with, pharmacists, people want to help. And if there's one person that you feel comfortable reaching out to, then that's, I think, the best way to start. Or if it's your spouse or someone from your family or a caregiver, reaching out to them as a voice, and they can be, your extended voice to reach out to the respective healthcare providers or team members that can help patients navigate their way through this journey in order to make it as easy as possible. It's not an easy task, just hearing a diagnosis and having to undergo treatment. But as a healthcare provider team, we want to try to make it as easy as possible for patients and their families and loved ones.
That's perfect. Thank you, Kelly. And you'd also mentioned reaching out to the person on your care team that you're most comfortable with, and kind of bridging that gap, that first time of being vulnerable, pulling yourself out there and trying to get the help you need. But you've also shared that in that network of providers, there's different perspectives they may have, different types of support that they can offer a patient. Once someone gets comfortable asking for help, how might they approach different members of the care team, or different types of support that they might be able to recommend?
Yeah, so I think once that opportunity presents itself and the can of worms is open, it's really just, letting your healthcare provider team help you navigate, to which respective provider might be best suitable for your specific needs. So if it's financial, the financial counselors or financial advisors, taking advantage of different groups, patient advocacy groups like Family Reach, financial groups, meals, all the different parties that are able to help patients for each and every respective patient's needs. I think it's really just, making that list, as Michael said, get in your pocket, going home and tackling it by yourself, or tackling it with your family or whoever is able to help you. I totally understand how hard it is having little ones running around and trying to tackle a list with the background noise and with wanting attention and everything else. So it's really just, taking the list of what you have to start with and tackling that list, and then reaching out through, other groups available and asking questions and asking advice to really, I think, hone in on kind of all different pillars, if I want to call them pillars, of different opportunities that can help patients throughout this journey.
I think that's so helpful. And what I hear in that is, don't be shy. And I think that's a recurring theme. Don't be shy.
Don't be shy.
Thank you. So I think this is maybe a good time to bring Jackie. And we've covered this from a couple different perspectives, but I think you have a very different one, or I shouldn't say different, an additive one from the patient advocacy perspective. And we'd love to hear a bit more about how you encourage patients to advocate for themselves.
Yeah, well, I think so much of it is exactly what we've all been talking about here today, is just really pushing yourself outside of that comfort zone, right? Acknowledging that talking about money is something that has long been a taboo. It doesn't come naturally for us. And when you have a lot of other concerns on your mind, it's easy to let it kind of go to the back burner, right? Like you're fighting for your life. So you're not necessarily thinking, first of all, about how I'm going to pay my utility bills, or is my car payment late this month? So really just first acknowledging that this is something that I likely will experience. Over half of cancer patients experience some sort of financial distress. And so kind of recognizing that early and acknowledging that this is not a personal fault. This is nothing that I did. This is something that's happening to me. And if I can push myself to be a little bit uncomfortable, there may be supports out there to help. So I think that's really the first thing, is just like sitting with that, acknowledging that, and allowing yourself the permission to seek out the support that maybe already be offered to you through friends, through family, and certainly in the clinical setting as well. One tool that I would definitely recommend, so here at Family Reach, we've developed these financial guidebooks, which can be a really helpful jumping off place. One aspect of the guidebook is that it has blank budgeting sheets within it. And so just the way that Michael said, it was really helpful to look at his monthly expenses and kind of look down the road a little bit. This tool will hopefully help you to do that. So it accounts for medical expenses, it accounts for all your household expenses, and it accounts even for those like extra expenses. Although I would say, as you're going through cancer treatment, like try to make room for that if you can, because it's so important to your well-being to have that Dunkin' Donuts, or to have those little special experiences for yourself and your family. So that would be, just a really great place to start is by downloading that book that's on our website at familyreach.org and starting to fill that out. I would say from there, Jim, if you can take that with you to your next appointment, it could really help to make that conversation a little bit easier with your healthcare provider, because you can say, look, this cancer resource is asking me to do this. Is there anything that you're seeing here that could potentially help lower some of these costs? Or if you're meeting with like the oncologist for the first time, the one element of the book is to encourage you to learn as much as you can about your treatment plan ahead of time. Of course, we all know that could change, right? Like it's not a guarantee what your treatment will be, but just knowing how many appointments can I expect this week or this month? How often will I have to travel to the hospital? How often will I have to pay for parking? That can really help you to start to create that budget.
I love those kinds of tools, and I'm so glad you brought them up. Michael, I don't know if you share this experience. I'd love to hear it, but it always helped me, whether it was from the medical or financial perspective. Anytime I knew I was going to go talk to a provider or someone in my support network, I would do my best, and I learned quickly to start doing it. Write down your thoughts ahead of time, because in that moment, it's always every time like getting hit by a freight train, and you just lose it all.
All right, so this, for me, and I would bring her in here if I could right now, but for me, it was bringing Leslie with me. If I didn't have my wife with me, I would FaceTime her on the phone and set it up so the doctors could see. And she would say, well, what about that, that thing, the lump that you were talking about? I'm, oh yeah, I totally forgot about that lump, So for me, it was, and anybody could do, just know what you need. For me, I needed my wife there to, remember things, because like you said, you walk into the doctor's office and I still am, even if we were both there, we would still do it. But with that being said, a lot of hospitals now, they have the patient portal, and you can just email, or it's basically an email. You can email the doctor, right, to the doctor or the nurse practitioner, and they'll answer you within 45 minutes. And I'm not kidding. And they'll say, you need to do this, or you need to come in. They'll set up an appointment right then and there. And if you have any questions, if you forgot something that you needed to ask them, with, the exception of, I have a lump, I need you to feel it. You can't do that. So that's another thing that, like, and I'm sure that if you needed to ask them any other question through the portal, that's a huge, we didn't have that when I first got diagnosed. They didn't have the patient portal, and they're really pushing it. And I'm kind of set in my ways, and I wasn't like, no, I'm not doing that. I'm going to come in, I'm going to be there and I'm going to ask you. And now, I was so recent that I had a short fever, and I was like, you know what, I'm going to try this patient portal thing. And I tried it, and they called me back within 15 minutes, and they were like, what's going on? What's the fever? This is what you need to do. Call your, primary. And if you can't talk to your primary, then go to the emergency room, and that was, for me, it was made it a little bit easier. So again, if you need to go in, or if you have any questions, definitely log into, and I'm sure that every hospital is doing it now, not just Mass General, but I'm sure, log into the patient portal and use that to its full extent, because there are people that are sitting at desks and they're there to answer your questions because they have so many patients.
That's perfect. And I think it ties in so nicely into what Kelly has shared, what you'd already shared, and what Jackie has started discussing as well, about being your own advocate, reaching out and leveraging the tools that are available to you. There are a lot, and it's so important to take advantage of them for yourself. And to that end, Jackie, we've talked a lot about reaching out, getting in touch with people who can help. Now, do you have a few examples of questions that families might bring to their social workers, for example, if they're worried about finances?
Yeah, sure, definitely. So oftentimes for people who are listening who haven't met with a social worker and don't necessarily know what to expect, it may help to know kind of what you're going into. Oftentimes when you meet with a social worker, they'll start by asking you questions just related to how you're coping with your diagnosis, if it's a new diagnosis, how you're coping with the treatment, if you're understanding everything that the medical team is sharing with you, and really they'll try to dig into what's causing you distress. If it's causing you fear, anxiety, sadness, those are things that the social workers are usually trained to kind of keep an eye out for. So I would say in that first meeting, it's a really good time if you are feeling some sort of financial strain or financial pressure, or even if you're just curious about what else is out there. That first meeting is a really good time to start that conversation, because it can help the social worker to really start to plan out what supports they will need to mobilize in your case. I know that the social worker in our video earlier before said that, that was her approach as well, was to look 2 weeks out, 4 weeks out, 8 weeks out, and to see what programs can I pull together. So hopefully the social worker will be the one to ask you those questions directly. But if not, then I would certainly say, like, just be honest about what are the issues that you're experiencing or that you can expect to experience. So if after that conversation with your doctor, you're worried about no longer being able to continue to work at the level you were before, you can start the conversation that way, just saying, I'm worried that I'm not going to be able to work through my treatment. This is going to impact my ability to pay my bills. Can you provide any guidance on income replacement programs? The social worker will probably know a lot of information about programs like SSI or SSDI. So that would be a good place to start to see, does my diagnosis or my expected treatment qualify me for either of these programs? You can also just ask things like, is there a billing department I can speak with about getting on a payment plan? It's generally better to get on a payment plan with the hospital early rather than to let bills go to collections. They get more expensive that way. Other things, just like, are there resources available in this community to help with the cost of food? There might be food banks that you can access. Again, not always an easy conversation to have, and will take some courage on your part. But I think you'll find that once you start those conversations, the information will flow your way, and it'll be a lot of information, as Michael shared before. So one other tip while I'm talking is, I would encourage patients to always keep with them, like you said, Jim, a notebook for questions that they want to ask, but also maybe extend that to like a binder where you can include different bills that you're responsible for each month, because typically for foundation support, that'll be something that's required. You can keep all of the important paperwork as it relates to short-term disability or FMLA or whatever it is that you're taking. And that's just a way to really help you stay organized and to make sure that you have the information with you when you're meeting with the social worker.
That's great advice. And one thing I'd want to punctuate, just based on my own personal experience in that, is that it can be hard, again, to talk about finance and to reach out to people and ask for help. But one thing I'll say is most not-for-profit hospitals are amenable to developing payment plans. And it's something that you should feel really comfortable and confident reaching out to a billing department and just going for it. You'll often find that there's some wiggle room there, and it's absolutely worth exploring. But we've talked then, a little bit about what they can do early on, what they can do early on in their diagnosis to find the support they need. And you've mentioned some things already really early in the process, thinking about keeping track of your finances, trying to plan, what can patients do early in their diagnosis to help arm, I suppose, the various network of caregivers to help them be successful.
Yeah. I think probably the most important thing to do early on is to get that understanding of what your treatment is going to look like. Again, I want to emphasize, I know that can change and often does change quickly for a lot of patients. But if you can have a general sense of what you might be facing, it can really help you to better understand what your options are financially. As detailed as you can get could be even more helpful. There's different copay assistance programs out there, prescription assistance programs out there. There's different ways to lower those costs up front, but you have to know the information to be able to access those type of supports. So really just learning what you can about your treatment is probably the first step in sort of addressing these financial concerns. As Michael said before, like I would always recommend if you have somebody that you can bring with you to those appointments, do it. You'll hear a lot of information at every appointment early on and throughout your whole experience, and having a second set of ears never hurts. So if you have somebody, bring them along.
That's great advice. And actually, something else I'll add. I know certainly my experience, my memory was really diminished over that period of time going through treatment, and the rest, there's nothing you can do about that. But it's another thing to acknowledge, to be aware of, and like Michael's done, use his family for support, or use some of the resources, Jackie, that you've suggested to help organize your thoughts before you meet with providers, or before you meet with social workers. I think that's tremendously helpful. I'm glad you mentioned that.
Yeah, and something else, Jim, that I wanted to mention is really organizing your community, or having, like, if you have somebody who you're close with, having that person organize your community. As Michael experienced, and I'm sure a lot of cancer patients experience, early on in the diagnosis, there's a lot of people who say, like, the general, like, let me know if there's anything I can do to help. It's really hard at that time to actually think of, okay, what can this person do to help? But there's different resources out there that can help plan, like, for instance, different meal deliveries. Like, so you can have people in your community cook meals ahead of time for days that you maybe are receiving chemo, or for after a big surgery. That can help just to kind of mobilize your community in an organized way. There's also different services. I know one that I've recently learned about is an organization called Hello Jasper, and that organization can help you plan rides back and forth. So people that, you know, are in your community, whether it's friends, family, or just people who want to lend a helping hand, may be able to, like, sign up to volunteer to drive you back and forth from treatment on days that you need that level of support.
Michael, so Jackie just shared in the past couple of minutes, I think, a lot of different opportunities for people to go help themselves, and I could see you nodding along with some of those.
Oh, yeah.
Are there any experiences with some of those support systems, whether it's your community organizing, rideshare, or anything else that you think you could share for folks?
Absolutely. So my children's school, they knew what we were going through. My kids, they're open to everything. I think I've mentioned this to you guys before, that I think my children are going to be the most understanding human being when it comes to, cancer diagnosis and how people should be treated, and how, what helped and what didn't, because they know nothing but that. I got diagnosed 7 years ago. My twins are 8. So they saw it firsthand. And like Jackie said, there was some instances where the school would get together, and we would come home from the hospital, and there would be a cooler on our back steps with a full meal and how to cook it, how to prepare it, and everything. And it's simple, and if not that, for me, the whole, let me know if there's anything I can do to help, just do it. I tell people that all the time. I'm like, not about me, but like, if the biggest thing that helped was just sitting here before dinner and the doorbell rings and it's the pizza guy, and you're like, I didn't order pizza, and then you get a text message from, so-and-so, hey, we ordered you pizza just because, we want you to take it easy tonight, and so that was huge, and so 2 of our friends found out what our favorite meal was, what our favorite restaurant was, and they got that delivered. They almost got it delivered too much. I got sick of it, but it was awesome. Like I said, like, just like Nike says too, just do it. You just got to do it. I'll tell you till my face turns red, is there anything I can do to help? But I know that if I see somebody that's, going through this, the biggest thing was just having it done, and, like I mentioned before, some people the people that you thought would do it, sometimes they aren't that the person that would do it, and for us, it was a lot of the people that we didn't expect, or, just came out of nowhere. They saw our story, or they heard about us through somebody else, and that they were like, they felt bad, or, for me, there was an instance where somebody helped us because I was so nice to her in first grade, and I'm not kidding you. That she sent my wife a message, your husband was nice to me in first grade because some kids are making fun of me and he stood up for me, and they didn't forget that. And they in turn helped me when I needed help. Like I was like, holy crap, I remember her, and I don't remember the instance, but she does. And she came out of nowhere and helped us. And a few times I think she did. So if that's not a sign to just be kind to everybody forever, then I don't know what is. So for me, it was having people just help us was big. And if not, if you feel more comfortable asking, get a little bit more in depth. Don't just say, is there anything I can do? Say, what's your favorite meal? You know what I mean? Or, say, I don't know, if you're financially, more stable and you can help them financially, then do that,
So that's a perfect transition to the last question I want to ask you, Michael. But if you could give one piece of advice, I know it's a loaded question, but one piece of advice to a newly diagnosed cancer patient, what would it be?
So my piece of advice to a newly diagnosed cancer patient, if they came up to me, whether I knew them or not, would be you just gotta ask somebody for help. You need to walk up to them and say, hey man, what happened? What was your reaction? It was you almost need to have the same conversation that all of us have had just now. You need to sit down and you need to just be like, you got to pick their brain. Hopefully you pick a person that is willing to help, but if not, move on to the next person and ask them. I think I mentioned to you guys last time we spoke, a friend of mine fell off the face of the earth when I got diagnosed, and then 7 years later he reached back out to me. He was a groomsman at my wedding. He reached back out to me and he asked me, he's like, hey, I'm hesitant to ask you this, but what happened? How'd you get sick? And I gave him my whole story. And he in turn said to me, after I think it took me an hour and a half to tell him exactly, from A to Z what happened to me. I didn't leave a thing out because he was such a good friend and I wanted him to know. And he said to me that he said, you made something that somebody could make sound so awful and so terrible, going through so many relapses. He said, you made it sound, so uplifting. And I said, yeah, man, that's how you got to live life. You got to live life one day at a time. You don't know what's coming around the corner. You got to fight to live, fight for your family. And I know that in turn, if he ever gets into a situation where somebody in his family or one of his other friends gets sick, he could turn and ask me, hey, remember that time you told me that? And I'll say, yeah, and I'll tell him exactly what to do and how to do it. And and so that's even somebody that wasn't sick. My friend wasn't sick, but he wanted to know what happened, and how did I get through it. So I mean, if that's not a way to, like, even if you're not sick or even if you just to be aware, and that's what this whole thing is about. I understand that we're here to establish that you need to spread the word. This needs to be aware, like an awareness that, people need help and people don't know how to ask for it. But if you know.
Michael, your willingness to share is inspirational. It really is. It certainly is for me. And I hope it is for the folks watching at home as well. I know we're coming up close on time. I just briefly wanted to thank Jackie, Kelly, Michael, and Family Reach for putting together such a wonderful program. It's something I'm genuinely proud to be associated with. But I want to turn over to Jackie to maybe close out and put a bow on everything.
Yeah, thank you, Jim. So I echo that. I think I've learned so much today just in this conversation, and wanted to thank Michael, especially you, for your honesty and your willingness to share more about your experiences, because you're right, it's so much of this is awareness. We need to make sure that everybody's aware that this may happen and feels comfortable asking for help. Kelly and Jim, thank you so much for coming here and sharing your expertise with us. I think we got a lot of good information, and I'm hopeful that this will really help people to feel more comfortable seeking out support in the future. So thank you for giving your time and your knowledge to us all. And to everybody watching, I just wanted to say thank you for joining us. This was our first Family Reach Session series, but there will be more to come. So follow along with us for updates. You can follow us on social media. You can sign up for our newsletter on our website at familyreach.org. And stay tuned to see what we're doing next. We got some really exciting stuff planned for the future.